My research I'm going to speak with you about today was actually a lot of the studies that I've been conducting through the University of North Carolina. And that research is regarding the use of saliva as a diagnostic tool to actually first condone and then monitor a diabetic state in patients. In order to do so, I have to give you a little bit of background. First on type 2 diabetes, and then the actual use of saliva as a diagnostic tool to monitor the systemic state. In doing so, first off, the important fact to understand is that my study was comprised entirely of patients who are characterized as edentulous subjects. This is a clinical term which refers to patients that have just experienced some form of tooth loss. Could be partial, could be complete. However, what's important is that previous studies have indicated that these individuals who have had some degree of tooth loss are actually predisposed to a diabetic state. And in doing so, these patients become fantastic models to then monitor what's termed a systemic condition, meaning a condition that's occurring all throughout the body, in this case being a hyperglycemic condition, and monitoring how this hyperglycemic condition is actually varying the components of their saliva. What we set out to do was really define whether we could examine a characteristic expression of a combination of specific salivary biomarkers that would actually distinguish a type 2 diabetic patient from a non-diabetic control. And the whole point of this is that if we were able to actually nail down the fact that we can see a differential expression or just a distinguishable difference in the amount of proteins that are present in a diabetic patient's saliva versus a non-diabetic patient's saliva, we can actually develop this into a diagnostic tool which will be much less invasive than the standard blood A1C finger prick that's characteristically used in most cases.